I think the main emphasis of my talk, if there's one message that I would like people to take away, is that clonal cytopenia of uncertain significance, or CCUS, and myelodysplastic syndrome, or MDS, are really a spectrum of disease, and there's really no sharply defining boundaries between the two, despite what we do in clinical practice. So as you know, in clinical practice, really the distinguishing feature between CCUS and MDS is the presence or absence of morphologic dysplasia. And I think, because determining whether there's dysplasia or not is really a subjective, finding, particularly in the case of very mild morphologic dysplasia. And because we have better and sensitive techniques now for detecting clonality and for detecting potential phenotypic abnormalities using methods other than morphology, such as flow cytometry, it's probably time that we refine the criteria for diagnostics and perhaps take into account some of the other phenotypic abnormalities other than just morphology, and also the trend of disease, trend of cytopenias, the degree of cytopenias, in determining whether a patient really has functional MDS, despite the fact of, despite the presence or absence of morphologic dysplasia.